Hello, I'm Debbie Bergio. Welcome to Winter Grace Senior Ministries. Hospice can be a scary word when we do not know what it entails. Often at the end of life of a loved one, we call in hospice, or the doctor suggests it. Fear can take over. John McIntyre from Seasons Hospice is here to talk to us today about the care and services offered by hospice and by Seasons. John, thank you for joining us today.
Thanks for having me.
So can you please share with us the process from when you're introduced to a family that's seeking hospice or palliative care services?
Sure. So I get introduced to families in the community in a variety of ways. I either get called from a physician's office or an assisted living facility, a nursing home, sometimes an adult son or daughter who have their mom or dad living with them in their own home will reach out to me. And basically what I try to do is help to educate the family on what the services are, and not only how they can benefit their loved one, but how it can also help to support the family members. One of the first steps that we do have to take is to make sure that if the family is interested in seeking hospice, that there is a hospice referral resource, whether it's from the attending physician or from the hospital directly or from a nursing home. But in order for somebody to qualify for hospice, it has to start with a hospice order. From the initial referral source, and it also has to be coupled with a yes from the other physician on our end. So it does require two physicians to okay that someone does meet hospice criteria.
Can you talk a little bit, what is hospice criteria?
Yeah, so according to Medicare, and hospice is a Medicare covered benefit, but according to Medicare, their guidelines are that someone meeting hospice criteria is somebody that a physician would look at and say, this person could likely pass within a 6-month period of time. And when I say that to families, I preface it by saying that nobody has a crystal ball in terms of the timeline of our lifelines. And so if somebody does meet hospice criteria for whatever their condition is, I do try to explain to families as best as I can that even though hospice, the criteria is 6 months, really their loved one, the course of their life is going to take their natural course, independent of that guideline, which means they could pass sooner or they could pass well past 6 months. We have patients who've been on service for us for well over a year. But in order for a physician to deem somebody meeting hospice criteria, they have to determine whether they feel that individual, that they have a 6-month or less period of living. Now, along those lines, there's a wide variety of reasons why someone would meet hospice criteria. I know when I was growing up and I heard the word hospice, a lot of times it was associated with patients who had cancer. But in the modern day hospice, it's associated with many different things: COPD, cardiac disease, dementia, Alzheimer's, diabetes, renal disease. So there's a variety of reasons why somebody could meet hospice criteria. So once that is determined, I help to educate the families on really what the support looks like coming from Seasons Hospice. And what that is the initial evaluation process starts with having an admission nurse come out to do an assessment, to do a head-to-toe evaluation, to really get a sense of the patient's baseline condition. They're also trying to determine in that visit whether they feel that the patient does meet criteria during that visit. If the patient does meet criteria, then the follow-up to that appointment will be the nurse who will become more of the nurse case manager, more of the patient's weekly nurse. A lot of times I get asked, well, what is the frequency of the visits?
Mm-hmm.
You really won't know that until the admission nurse is done with their assessment. And those visits can increase um, depending on the needs of the patient. If their needs increase, then if their level of acuity rises, then the um, the number of our visits or the frequency of our visits can increase as well.
Okay.
So we talked about the follow-up with our nurse case manager. Just to give you an idea of some of the other members of our team, we have a home health aide, we have a social worker, we have a music therapist, and I will preface that our music therapists are all board certified, master's degreed. So they are all clinical, right? They're not entertainers. They are
Right.
coming in and they are really trying to help. A lot of times they're helping to decrease anxiety. And they do that with music. And it's not just for the patient, it can be for the family as well, you know, to take them back to a song, maybe their wedding song
Mm-hmm.
or a song that made them happy. There's an abstract part of music therapy that's really hard to describe. You have to really kind of be there and see it, but it's pretty
Sure.
amazing, especially with patients who have cognitive challenges.
Mm-hmm.
Um, and to see really that transformation just in that short period of time of them tuning into a song that they may recognize from their past. It's a pretty special thing to witness. So that's part, our music therapists are part of our care team. We have chaplain support. They're non-denominational, and so they can accommodate many different denominations. Um, we have rabbis who can support those who worship in the Jewish faith, and so we really do try to customize the care and support. Uh,
Mm-hmm.
it's not a one size fits all. We really want to understand not only the patient's clinical needs but their personal their personal journey as well. We have a program called Namaste, which is something that is it helps to honor their kind of their wishes. We had a patient who was blind who was in the military, in the Navy, and one of his last wishes was he wanted to step foot on the boat that he was on years ago, and we were actually able to set up that trip down to Norfolk, Virginia. And even though he was blind, just getting on the rig and the smell just brought everything
Mm-hmm.
back to him. So we try to really get creative with that. And a lot of it depends on the family. You know, the family really drives how much or how little of that experience they want.
Mm-hmm.
Um, and so, but it's nice that, we do have that in place. We also have we honor veterans program. We do pinning ceremonies for veterans, where they get a pin and a certificate so that we can honor the service that they've provided to our country.
That's
So
terrific.
there's a lot of different things that we can do to not only support the needs of the patient, but also to make this a lasting experience for the family.
Mm-hmm.
Um, One other thing, while I'm thinking about it, is under the hospice umbrella, the Medicare umbrella, a patient is also eligible to receive any durable medical equipment, which would be a hospital bed, wheelchair, walker, oxygen, bedside table, um, a portable potty chair, shower chair, Jerry chair. So those are all available. I do get asked if we supply things like diapers or pull-ups or chalks.
Mm-hmm.
Even though that is not under that criteria, what
Right.
I do tell families is that upon each visit, whether it's from our nurse or our aide, we supplement those materials. So we do bring those upon each visit. So we're
Okay.
essentially providing those, but I do recommend to families that they do have some materials on hand so that
Mm-hmm.
they can kind of offset, in case there's limited supplies, things of that nature.
Of course.
Yeah.
So
Um, Go ahead. I'm sorry.
no, please continue. You're
Well, I was going to say, the one caveat to kind of what we're talking about right now, obviously, is, we are living in a pandemic right now, which is,
mm-hmm.
kind of new and different for all of us. And I did want to preface the fact that our nurses and any of our team members, we are all are following CDC guidelines, and meaning that we are coming in full protective equipment. Our nurses and our aides are getting tested weekly. So we do want to make sure that families understand that we are trying to take every precaution to keep not only their loved one and their family members safe, but ourselves safe, and make sure that we're compliant throughout this pandemic.
Absolutely. Until, I don't know, maybe 10 years ago, I thought hospice was an in-person, an in-facility service. I didn't even know that hospice came to the home. So do you have, the seasons provide both settings of care?
We do, and you're not alone in thinking that. Quite a high percentage of patients, families that I meet with, they ask about that very question, which is a good question. Really, my answer is that we serve patients anywhere that they call home. So really, if they're living in their own home or an assisted living or nursing home, we can come to them. We do also have 3 inpatient units. Um, and what these are within on the wing off of a floor in a hospital. So we have one at Northwest Hospital, one at Sinai Hospital, and one at Franklin Square Hospital. And there are, I believe, they are 14-bed, individual bed, private rooms. And similar to where someone would need to meet routine level of hospice criteria, meaning to receive hospice in a home setting, someone to receive inpatient level of care would need to be reevaluated for eligibility for that stepped up level of care. And so in a case like that, we would do something called a doc-to-doc conversation, where the attending physician of that patient would speak with our physician to discuss the increased needs of that patient. And if they did meet criteria, then they would be eligible to go to the unit and get round-the-clock care. So that's for more acute cases, more patients that are more eminent, so to speak. But it is a great resource for patients and their families. I tend to see that there's a great trend, even before the pandemic, of our local community wanting, our community members, their wishes are to pass it home if at all possible. And I respect that. Sometimes based on the individual's condition, and let's say if they have uncontrolled pain, which is a big criteria for meeting inpatient level criteria, and they could be better served being in a unit and having their pain controlled, as opposed to being at home. That's one example of where that really may be the better option and the more humane option, not only to the patient, but to the family as well.
Thank you. I didn't know that distinction about how those distinctions are made between which setting is more appropriate.
Yeah, it's and the nice thing about it, Debbie, is that we feel like we've got our patients and their families covered really in any type of scenario. We also have another layer of care called continuous care. So what's unique about this is if a patient is receiving hospice services at home and they start to show inpatient level symptoms, meaning uncontrolled symptoms, whether it's uncontrolled breathing, uncontrolled pain, uncontrolled diarrhea, whatever that may be, but they truly want to remain at home, we can have another nurse come and stay with that patient one-on-one until their symptoms are leveled out. And again, that is another part of the service that's covered under Medicare. Not every hospice care provider in this area provides continuous care, but that is something that not only Seasons provides, but that is an emerging growth level of growth that we are going through, because there's such an increased need for it. Because again, there's so much need, or the wishes of the community members are to remain at home if at all possible. So it's that need is increasing because we're trying to meet the demands to care for them at home.
And one comment that I heard right at the beginning of my introduction to hospice was from a woman who said that hospice care allowed her to become, instead of being the caregiver, go back to being a wife again and not being the caregiver. And it was just from her heart. She was able to be with her husband and support her husband as her husband, not as someone she was caring, taking care of the necessities for, I guess.
Absolutely. And that's something that I really try to make very clear with families when I meet with them is that this isn't, I know a lot of the focus is on your loved one whose care needs are at the focus, but it's
First.
also to try to help you, the caregivers, because one of the realities of caregiving is there's fatigue that can be associated with that as well. And so the well-being of family members is of the utmost of importance to us as well. Having the social worker be able to plug into family members and have them kind of offload some of the heavy burden that they're feeling. We've had family members come back to us and say, what a huge impact that was on them because it helped to support them.
Mm-hmm.
We also have respite programs that we can provide, meaning we can give family members respite where they can get a break from their caregiving, where their loved one can go to a facility for even if it's a weekend. And again, we're in a pandemic, so these are unique circumstances, but providing respite care for the family is also something that we are able to do on a regular basis.
That's a lovely service. It's a wonderful gift that you give to the family.
Yeah, I mean it's a team effort. I when I talk to families, it's interesting because I kind of use the analogy of when I start conversations with families, we're on the front end of the bridge, and I'm helping them to cross over the bridge, right? And so
Right.
and I reference other families that have utilized hospice care who have crossed the bridge, and have kind of come over to the other side and how impactful they've found it. And many of them say the same thing. Wow, I knew so little prior to crossing over the bridge, taking a little bit of a leap of faith, but it wasn't so good. It wasn't that it was just so good for my mom or dad. It was so good for us. And
Mm-hmm.
and we do try to become part of their family in a sense, with certainly honoring and respecting their privacy, but we are a unique presence in their life. And it's a very rewarding thing, growing up in this local community to support, the people in this community and to help them gain a better understanding of what this benefit is, and helping them take a little bit of a leap of faith. In the process.
Excellent. John, thank you so much for sharing about the whole hospice process and seasons in general as a whole. There's more information on seasons below this interview on the webpage, but I just want to thank you for being part of our event and thank you for sharing such a valuable and service at such a sacred time in someone's life.
My pleasure, Debbie. Thanks so much for having me.
Have a great day.
You too.